Welcome. Today's video is about readiness for therapy and what to expect on your therapy journey. This is for clients who may be attending the Psychological Therapies service, Regional Trauma Network, or Psychology for Older People's services. We'll start by exploring what high-intensity therapy is, and I'll identify the types of therapists who deliver it. Then we'll consider the practical arrangements that must be in place to allow therapy to be most effective. And finally, we'll look at the Readiness for Therapy questionnaire, which will help you to consider whether or not therapy is right for you at the moment. Let's start by exploring what high-intensity therapy is, and I'll identify the types of therapists we have to deliver it. The Psychological Therapies service, Regional Trauma Network, and Psychology for Older People's services all offer a range of goal-focused, high-intensity therapies. High-intensity therapy often focuses on modifying the roots of your difficulties, which may be based in the distant past. It delves into the processes which underlie your current difficulties and have kept them going over a long period of time. It is therefore particularly helpful for long-term difficulties where the person is willing and able to delve under the surface level of everyday symptoms. So, for example, high-intensity cognitive behavioural therapy may examine core beliefs which have their roots in early years as part of the treatment. In this example, you can see that Beth experienced early life events such as parental stress and their eventual separation. The parental breakup left Beth's mother in difficulty as she worked 3 jobs to make ends meet. Due to her struggles, despite her best efforts, she was unable to meet Beth's needs adequately. Both parents, due to their own stress, tended to be irritable frequently and took this out on Beth, criticising her unfairly. These experiences led to the formation of Beth's deeply held core beliefs that she was unlovable and that people are critical, unreliable, and liable to leave, and that she was inherently flawed or not good enough. Beth was not aware of all these core beliefs, but was aware of her daily thought stream, which is based in the core beliefs. For example, negative automatic thoughts in response to everyday life events include: he thinks I'm useless, she won't want to help me, I'm no good at this, they're better than me, and he won't stay with me. Although we would work at surface level, we would also address the core beliefs via cognitive behavioural therapy or via other therapeutic approaches, such as schema therapy. High-intensity therapy sessions tend to last at least 1 hour, and session number will be discussed with your therapist at the point of assessment. We know that more therapy is not necessarily better, and there is a law of diminishing returns whereby therapy can become less and less helpful over time, before tipping over to the point where it can be unhelpful or even detrimental. It's true that you can have too much of a good thing. Here are some of the high-intensity therapies we offer, but please note that they're not all suitable for everybody, and your therapist will be well placed to discern what might work best for you. The high-intensity therapies we offer are based on treatment protocols endorsed by national guidelines, with adaptations made as appropriate depending on the specific needs and particular symptom profiles of each individual client. We don't offer low-intensity therapy in the Psychological Therapies service, Regional Trauma Network, or Psychology for Older People's service. Nevertheless, let's contrast high-intensity therapy with low-intensity therapy. Low-intensity therapy focuses on the surface level only, and often this is all that is required, and a deeper focus on roots and early history is not going to be necessary or beneficial. This work may centre on improving sleep, minimising caffeine use, or reviewing food intake so that the brain receives the nutrients it requires. It may also explore how thoughts, behaviours, emotions, and physical symptoms are interconnected and how addressing one element can impact the others. Typically, low-intensity therapy may involve 8 sessions, each of at least 30 minutes duration. Low-intensity therapy may be all that is required or all that is tolerable for you at present. Working at this surface level using techniques such as behavioural activation can be very effective. Often it may be the first step in your recovery and may be all you need or all you can manage at present. It may provide a strong basis for high-intensity therapy if needed later. An example of low-intensity therapy is the SPIRIT CBT program, where SPIRIT stands for Structured Psychosocial Interventions in Teams. Some practitioners within some community mental health teams are trained in this and can provide low-intensity CBT on a one-to-one or group basis. Some GP surgeries also have a cognitive behavioural therapist who can offer low-intensity therapy. It can also be obtained in various organisations within the community and voluntary sector. Whether low or high-intensity therapy, it'll be an active process focused on helping you to achieve your goals. You'll be practicing doing things differently in your life and breaking old behavioural patterns. Often therapy is referred to as talking therapy, but the truth is that it's as much a doing therapy as a talking therapy. You may feel like a fish out of water until new insights, methods and behaviours become familiar. But it's okay, your therapist is here to support you. Counselling is different again. For example, person-centred counselling is not goal-focused and allows you to discuss whatever is troubling you on a given week. It's non-directive and not goal-focused, and therefore very much led by you. We do not offer person-centred counselling in the Trust, but it can be obtained in some community and voluntary sector organisations. Another thing we don't offer is medical review. We are not medically trained and therefore cannot give you advice about medication. However, this may be obtained from your GP, psychiatrist or community psychiatric nurse. Which brings us to our therapists. Our therapists are all highly trained to postgraduate level. We have clinical and counselling psychologists, cognitive behavioural therapists and psychological therapists. We have male and female therapists across a range of ages and core professions, all with the common goal of helping you to recover. We want you to benefit from therapy as much as possible. There are certain basic things that can help or hinder therapy. Let's look at them together. It will take a little time for you to feel comfortable with your therapist, and that's normal. Your therapist is an unfamiliar person, and you'll be discussing very difficult things with them. Try to tell your therapist how you're feeling about therapy. This will help them to modify things however possible to help you feel more comfortable. It's a courageous step to come to therapy. You may struggle to open up about your difficulties. Sometimes people find it easier to write down particularly difficult things rather than express them aloud. Your therapist can then read what you've written. In time, it will get easier to reflect on thoughts and feelings aloud. And it will take time for recovery. Feelings can sometimes worsen before they improve, but applying therapy methods consistently over time will take effect. Be patient with yourself and remember, time is a great healer too, and therapy will be paced according to your needs. Also, on the subject of time, you'll see your therapist for 1 hour and sessions will usually be fortnightly for around 6 months' time. If weekly, there are 167 hours between sessions. If fortnightly, there are 335 hours between them. So you can see that your sessions are a drop in the ocean of time. This has several implications. Firstly, it can be difficult to make progress if any time is lost in sessions. Your therapist will do their very best to arrange a therapy slot that suits you so that it will be easier for you to attend each week. We know that life can be busy and occasionally unexpected events arise, but please do your best to arrive on time because we want you to benefit as much as possible. Hopefully you can make your therapy a priority in your life. Feel free to come 5 or 10 minutes early to get settled or refreshed if needed. Again, you'll understand that if there are cancellations or if you don't attend your appointment, this makes the time between sessions even longer. This can get in the way of momentum in therapy and continuity between sessions. Momentum occurs where the gains of one session builds us up for further gains in the next. Change can be slow and steady, but it can also build up and result in the phenomenon known as sudden gains, where large symptom improvements then occur between sessions. And when this happens, it's wonderful to see. Because attendance is so important, we do have an attendance and discharge policy, and this is the policy here. We ask that if you have to cancel an appointment on occasion, please give us at least 24 hours notice, but better if it's 48 hours notice because then we can allocate your appointment to someone else who might need it. If you don't arrive for your appointment without letting us know, this is known as a did not attend or DNA. As you can see, we may not be able to continue if cancellations or DNAs are frequent, as therapy is unlikely to be effective in that context. As you've seen, there's plenty of time between sessions to reflect upon learning, make further discoveries, and practice therapeutic methods. The more you can do this, the more effective therapy will be. So think about whether you can fence off some protected time for therapy-related tasks each week. You might be asked to complete logs or engage in particular activities, and it's not fair to expect yourself to do such things if time is short. Therapy might only become an annoyance if your life doesn't have space for it, and we don't want that. Here are some examples of stressors that may get in the way of therapy work and may need to be addressed in advance of therapy. All that we do is aimed at helping you to achieve your goals. So it will be important for you to think carefully about what you want to achieve from therapy. What would you be able to do if you recovered that you can't do now? Remember though, goals should be realistic, and we might set short, medium and long-term goals, and even make them SMART so we can be sure whether or not they've been met. We also use questionnaires every session, and here is an example of a generic one. You might receive these electronically or in hard copy. Charting your symptoms over time helps you and your therapist to see how you're progressing, what needs further attention, and to what extent your goals are being realised. Therapy must be collaborative. We can never be locked in a tug of war with you and your therapist pulling against each other. This would not be good for you or your therapist. Occasionally, it can be helpful for a family member or support person to attend some sessions with you, but this should be discussed first with your therapist. That's not to say you won't have some mixed feelings about therapy and making the changes it involves. That's absolutely normal. Often we want change to happen, but we perceive the process of making changes as uncomfortable. Inasmuch as the way things are is difficult, it is familiar. New and unfamiliar things and the uncertainty this brings can be daunting. In coming to therapy, you're committing to navigating through these difficult emotions and making friends with the discomfort. Discomfort in time will give way to a sense of achievement, strengthening in relationships with others, and improved quality of life. However, it is the case that sometimes we really don't want to change things. We may have difficulties, but for whatever reason, it's not the right time for change. And that's okay too. It's important to recognize that and know that you can come for therapy in the future when it is the right time. Thinking about stages of change, pre-contemplation is the stage where the person does not see any difficulty that needs to be changed. In the contemplation stage, a difficulty is perceived and there is some intention to make a change in the future. There may still be ambivalence, but the person is slowly building a case to initiate change. In pre-contemplation, therapy would not be suitable. But in contemplation, therapy may be suitable and becomes increasingly suitable as the person moves through contemplation towards preparation. It may be helpful to think not only about the desired change or goal, but also about the pros and cons of change. This might help to build motivation where this is needed. Change is a very active process. No one can change you. You must want to change, and with our help, be your own agent of change. Don't wait for change to happen to you. It's often the case that changing our behaviour helps us to change our thoughts about ourselves, others, and the world. So be willing to try out new things or new methods of coping. It'll be worth it, especially when feelings change as a consequence. When we try to change our thoughts alone, we might know something is safe, but it doesn't feel that way. This is normal, and we call it the head-heart lag. When we actually experience things and see for ourselves that it's safe, the head-heart lag closes and we begin to feel safe as well. As therapy progresses, you'll learn what changes have worked for you. Although some changes might seem quite small, they all add up, making eventual big changes. But it's very important not to drop changes you make along the way, even if those particular changes are no longer the focus for therapy. As you're thinking about the prospect of therapy, be honest with yourself. If therapy would be too far to reach at the moment, we can help you to consider alternatives. Or perhaps now is the right time for therapy work, and you should give yourself some encouragement. And now let's have a brief look at a couple of questionnaires all about readiness for therapy. First, the Readiness for Therapy questionnaire by Gomi et al. This questionnaire is made up of 6 items to consider. You can see the response options at the bottom right. Item 1 is, it's essential that I work on my problems as soon as possible because they are affecting my quality of life. If you agree or strongly agree with this statement, this bodes well for therapy. Item 2 is, I like to do things the way I've always done them and I don't want to change. If you agree or strongly agree with this item, this is not a good sign for therapy. Item 3 is, if I'm skeptical about something, I'm not willing to try it. Again, if you agree or strongly agree, this does not augur well for therapy. Item 4 is, even if therapy becomes difficult, I will stick with it to the end. It's a good sign if you agree or strongly agree with this item. Item 5 is, in between the sessions, I will dedicate time to regularly practice the things I learn in therapy. It bodes well if you agree or strongly agree with this one too. And item 6 is, I won't attend therapy if I have something more pressing or interesting planned. Agreeing or strongly agreeing with this item does not augur well for therapy. There is also the Readiness for Psychotherapy Index by Ogrodnikzuk et al. It has 20 questions altogether, but we won't go through them all. Instead, we'll just look at the 4 factors they identified as important readiness for therapy indicators. They named the first factor disinterest. If you think your difficulties don't bother you much, will eventually go away on their own, don't need urgent attention, and that you don't have a keenness to work hard in therapy at the moment, all these things would suggest your current disinterest is high, and therefore therapy might not be right for you at the moment. Or if these things aren't true for you, perhaps therapy is right for you now. The second factor is perseverance. If you think that you can't endure some discomfort in therapy and can't work hard at practicing what you learn in therapy between sessions, therapy might not be right for you at present. Thirdly, we have openness. If you can talk freely, be honest and open in therapy, even about difficult things, this bodes well for therapy. And finally, we have distress. If your difficulties make you feel unhappy, perhaps ashamed or distressed, and you see a need to work on them now, this is a positive sign for therapy. And let's summarise. This video has been aimed at giving you an idea of what high-intensity therapy is, what it entails, and the types of therapists we have to deliver it. We contrasted this with low-intensity therapy. Then we explored the practical things that allow therapy to be effective, such as regular attendance, punctuality, protected time for therapy, goals, collaboration, and use of symptom measures. We also considered mixed feelings, and how some level of this is absolutely normal. However, too much of this, and rather than mixed feelings, we have too little desire for therapy. We considered stages of change, and sometimes it takes time to reach the stage of contemplation, preparation, and action. Finally, we briefly explored some of the Readiness for Therapy questionnaires to help you to gauge your current readiness. Thank you for watching, and see you again soon.